All right, welcome to OEA's live Q&A about the COVID vaccine. We have a lot going on right now, including this great information that we're bringing to you today. So we're glad that you're on, whether you're watching Facebook Live or whether you have joined us through registering and the Zoom call. Like I said, we've got a lot going on right now, so I want to take just a minute to tell you about a couple of other opportunities coming up this week for OEA members. We have 2 town halls with Superintendent Joy Hoffmeister. One is February 2nd at 7 p.m. and one February 10th at 5 o'clock. Superintendent Hoffmeister wants to get information and get feedback from practitioners in our schools. So with COVID going on, you can't get in big groups unless you're teaching in person. And so anyway, I'll just move past that comment. And so we're going to have an opportunity to speak with Superintendent Hoffmeister. It's a super great opportunity. Also, you'll want to join a roundtable discussion with our OEA Vice President, Catherine Bishop, and NEA Director, Shauna Mott-Wright, to give your insights about what you need for a successful post-pandemic recovery for your classroom, for your school, for you and your job. So you have 2 opportunities to join and give input. Tomorrow, Thursday, January 28th at 5:15, or February 4th at 4:30. And all of these dates and ways to register were sent out in the Edge. They're also on Facebook as events. So you can find more information on our webpage, on our Facebook page, or in the emails that we send. And we just got notification a couple of days ago that that NEA is hosting, NEA and AFT actually are hosting a fireside chat with Dr. Fauci, and that is also tomorrow at 5 o'clock. So we've got a lot going on. Organizing conference, save the date for February 26th and 27th, and that's a lot of participation and ways that you can get in more information. So having inundated you with opportunities, I want to say thank you for all that you do for our students, for our state, and for getting on to listen to and get more information to help yourself and your colleagues out. I'm going to turn the program over to Catherine in just a minute. I just want to tell you that Catherine is the governance lead of all things COVID and vaccine related. So Catherine has been to the press conferences and virtually, has watched the pressers, has done the research, and reached out to the Oklahoma State Department of Health to set this up. So I'm going to turn it over to OEA Vice President Catherine Bishop to host tonight. Catherine?
Great. Thank you, Alicia, and thank you to everyone that's on the call with us here virtually on the Zoom meeting or watching through our Facebook Live post. Tonight we have with us Deputy Commissioner Keith Reed. He has worked at the State of Oklahoma Health Department of Oklahoma for 24 years, the past 19 years with the Oklahoma State Department of Health. While at the Department of Health, Keith has served in multiple positions within the agency and currently serves as Deputy Commissioner for Community Health Services. He obtained his Bachelor's of Science in Nursing at Oklahoma's Northeastern State University and a Master's of Public Health degree from the University of Oklahoma. In addition to his public health career, Keith is also a colonel in the Oklahoma Air National Guard, serving multiple tours in support of Operation Iraq and Enduring Freedom. He is currently assigned as commander to the 137th Special Operations Medical Group. That's a lot to say in one sentence. With the Will Rogers Air National Guard base in Oklahoma City. Deputy Commissioner Reed, thank you for being here with us tonight and answering all questions around the COVID vaccination especially how it applies for educators that, and when I say educators, teachers, support professionals, administrators, everybody in our schoolhouse that are helping provide services for our students. So welcome, Deputy Commissioner Reed.
Well, thank you. Thank you for having me. I appreciate that. Let me first say thank you to everybody on here and all the teachers in Oklahoma. I know COVID has been challenging for many sectors across the state. We've felt the brunt of it in public health, and I know you have in the school settings, and I know I hear a lot from our local public health officials and staff that work closely with the schools. So we appreciate what you do, the challenges you have experienced over this past, it's coming on a year now, if you can believe that. So we just really appreciate all the challenges and everything you do. So it's good to talk about something that is a potential solution here. Not a potential solution, it is a solution. It's something that can push us over the edge and get this pandemic behind us and get us all back to some sense of normalcy. And we're certainly looking forward to that. We're making good progress, albeit painfully slow at times, it seems like. We actually, we've given, as of last night, we've given out over 350,000 vaccines to Oklahomans, and about 300,000 of that is first doses, and then 50,000 represents individuals that have completed their series. And that number, the ones for completed series, is really going to take off next week as we start. Next week is kind of the fourth week anniversary of when we started really large scale clinics and started vaccinating a lot of people, especially our 65 plus population. So next week means there'll be a lot of boost doses, a lot of booster appointments that'll be coming online, and we'll get those individuals completed on their series. And that's our focus area right now is 65 plus. We are still vaccinating healthcare workers, first responders, EMS workers that maybe didn't get it during the first few weeks. They still are eligible to get it right now. But the big group, the big focus group right now is 65 plus. That's a big group. There's about 635,000 people in that particular group. And we're looking, the data that I firmly have in hand shows that we've administered first doses to about 28% of that group. I know it's a little higher than that because we don't have access to the data from our partners at CVS and Walgreens and those that they've been vaccinating in this age group in long-term care settings, because that's included in the 635,000. So I anticipate we're probably right around the 35% mark on total first doses for those 65 and up. So we're making some headway to that group. And after that group comes under 65 with comorbidities. And then right behind that is teachers and staff, support staff, and pre-K through 12. And I know that's the area you're concerned with. So with that overview, I think I'll just flip it back to you, Catherine, and we can go right into questions.
Great. Thank you, Deputy Commissioner. So if you're on the Zoom meeting with us and you have a question, we want you to put your questions in the chat. Be sure and put your put your name, first, last name, put your first, last name on your paper, just like you're supposed to do. Put your school district, and then type in your questions, and then we'll get those in the queue. We, Deputy Commissioner, we had opened it up ahead of time, so people have already submitted questions. So let's just go to our first question if you're ready.
Sure.
And it comes from Jana, and she teaches in Hugo Public Schools, way down south, way close to the border, right?
Right.
And she says, I live in Texas, but teach in Oklahoma. Can I get the vaccine with other Oklahoma teachers? I read where I don't live in Oklahoma, if I don't live in Oklahoma, I'll be turned away. I don't understand this since I teach in Oklahoma.
So that's a very interesting question. And let me give you a couple scenarios that kind of help align this. First of all, we initially made exceptions for healthcare workers, for example, that were working in the state supporting our healthcare system. It only makes sense that we would vaccinate them because that's an important part of us maintaining a healthy workforce within the healthcare system who is under a lot of strain from COVID. Then we went, when we went beyond that group and we started opening up to 65 plus, we experienced an influx of people from out of state just coming over to get vaccinated. It didn't work in the state or anything like that. So they were just coming in pretty much at large. So that's when we had to put up some some virtual borders, if you will, and say, sorry, our allocation that we get from the federal government is for the state of Oklahoma and based on our population. So we need to keep the vaccine for Oklahoma residents. Having said that, I think that we could have some discussion about those that work in the state as some exceptions to that. And I would be interested if y'all could get me some information about maybe how many teachers that are residents from out of state actually teach in the state, because I do think it's worth a discussion to have that the health of our schools is important, like the health of our healthcare system. So it's something I'd definitely be interested in engaging in conversation. As a general rule, though, it's for Oklahoma residents, but we could consider other situations on an exception basis such as this. So I'd like to get a little bit more information from your organization to tell us about how many people we would be looking at and how many people that would impact.
I've written that down, and we can definitely help you. I know in Hugo, there is a large percentage, a lot of teachers that have retired from Texas, and now they teach in Oklahoma. So our borders, we may find a lot, but we can definitely get you that information. So thank you. Our next question is from, let's talk, you spoke that we're in the age of 65 and older, and those are, we want to get as many, we're going to get our teachers that are 65 or older, that are support professionals, everybody in our schools that are 65 and older vaccinated, but it also applies a great deal to our retired folks. And so we received several questions for that. Okay. But let's go with this. Who can give the vaccine?
So,
can a school nurse? We have nurses in our schools. Can our school nurses give them?
So yeah, I mean, as long as it's within the scope of the licensed professional, then they would be eligible to give it. So there's a couple of aspects to that. One is it within their scope to give the vaccine? And that's an easy one. Yes, a nurse should be able to get this vaccine. The second question is, can they give it as part of the organization? And that's where we need to make sure that we're working with pandemic providers. We've had different organizations around the state sign up as pandemic providers, and they have agreed through memorandums of agreement with us and the CDC, because keep in mind, vaccine and supplies are actually federal assets. We become a pass-through on them when they come into the state. So they're actually federal assets, so we have to follow their rules with this. But these pandemic providers have agreed to follow proper storage of the vaccine, administration guidelines of the vaccine, and also reporting of administration. What we have done in some cases with schools with testing is we have kind of brought the nurses in to work with us through some of our push partner agreements or as volunteers under Medical Reserve Corps, so that they can administer tests under the umbrella of the local health department. We could do the same thing with school nurses. So I think it's a school probably wouldn't qualify as a pandemic provider, but I think through local partnerships and working with them, that we can provide an umbrella to where those nurses could provide vaccinations as an extension of the local health jurisdiction. And it's, again, local partnerships we'd love to explore more.
Right. So you talked about, you talked a little bit about pandemic partners. Who is it? I keep hearing this a lot. Pandemic partners. Are they private groups? Who are the pandemic partners?
It's a real combination. Right now we have, I think it's about 1,467 pandemic providers that have been signed up across the state. So this includes pharmacies. It includes large hospital systems. So, your large systems in the metro, Integris, St. Francis, OU, those are pandemic partners. It can include your local primary care physician. If they sign up from, your local community, they could be an eligible pandemic providers. A dialysis center could be a pandemic provider. Any organization that has the capacity to provide vaccinations and can meet the storage and handling requirements and reporting requirements of the vaccine can potentially qualify as a pandemic provider. We've had some businesses that have their own health and wellness function within them, really large businesses that have their own health clinics. We've had them sign up as pandemic providers. So the goal here is, as we get more vaccine, we engage more of these providers so that they can add more access points for Oklahomans to get vaccinated.
I'm looking at my spreadsheet and watching the boxes jump around. So thank you for that. That kind of helps bring about that common language. So when we
Sure.
hear that, and we know that those pandemic partners aren't going out and buying vaccine, they're getting
No.
it from you, right?
It would be an allocation from us, and what we do is we engage them a few at a time as the vaccine supply will allow. Next week, for example, we'll start bringing on a few pharmacies into the mix and giving them some vaccine. Probably 3 weeks ago, we engaged some federally qualified healthcare centers around the state to bring them into the mix. So we'll just continue to add more and more as vaccine supply allows.
Okay, great. So let's talk a little bit about the vaccine. I call it all different terms. Vaccine registration portal, mainly the portal that we need to go to and register. We have made sure that our president, Alicia Priest, has fulfilled her commitment and is registered on the portal. We were her accountability people to do that. And so that's an important thing. When we had a question from Jenny from Stillwater, when do you anticipate, here's a hot question, when do you anticipate teachers getting vaccinated? What, give us an approximate date. We want to know.
Today, if you're over 65. How's that?
Okay.
So that's a really difficult, it's a very important question. And as you can imagine, probably the most common question I get asked is, when will my group be eligible? So let me just say that the group we're in right now, the 65 plus, is by far been so disproportionately impacted by COVID. I mean, I'm not taking away from anybody that has been impacted, has experienced, the loss of loved ones and such, but the 65 plus has really been impacted. I'll give you an example. Today, the state health department reported out 65 deaths from COVID-19. Of those, 50 were over the age of 65. So it is so important right now that we work through and get further through our 65 plus. The other part of it is that this particular group, you mentioned the scheduling portal. It is not an ideal fit for this group, and we know that. Unfortunately, we suffer from a lack of good choices, a lack of good options when it comes to COVID. So we try to get a mix of them. The scheduling portal is part of our public health system, so it's tied to our big pods to try to get opportunities there. But we're also working through 211, through local health departments, through some partner groups to get lists of those 65 and over that aren't eligible for appointments through the portal. We can't really afford to create a situation where we have other groups brought on to create competition for the 65 plus to get their vaccine. We got to get this group further along. I anticipate we're not going to wait to get 100% through this group. I mentioned we're probably around 33, 35%, something like that, that have received their first dose in this age group. But this group is 635,000 people in the state. So we're about a third of the way through that. I'm not saying we're going to get 100% through them before we bring on another group, but I do feel like we probably need to get around the 2/3 point or something like that. Don't hold me to that number. It's not a trigger point. I'm just trying to give you an idea of what I feel like we need to do to give that group an opportunity to get vaccinated and not have to unfairly compete for very limited vaccine and appointments. Now, having said that, once we get to that group, we still have those below 65 with comorbidities. That group is important too. They've been disproportionately affected as well. I don't anticipate us being in a phase with that group near as long. And I'm not quite as worried about creating an unfair system to where they can't compete for appointments either. So I feel like we'll move through that group a little faster, and then we're to the pre-K through 12th teachers and support staff. So I'm not going to estimate a date. I'm going to go with my standard answer. It's going to depend on vaccine supply. If we could get a big influx of vaccine into the state and we can start engaging those pandemic providers, then we start opening up a lot faster, and we don't worry so much about very limited supply and appointments. Right. So the vaccine supply is the other key part of that.
Great. Yeah, I think I keep hearing, I remember when we first started, we were only getting 30 30,000 doses a week, and it's still pretty close because you got boost dose coming in now and all that kind of good stuff we can
Right.
talk about later. So Jane Ann, she's a retired educator from Putnam City, had a really good question. Will being on penicillin affect the effectiveness of the vaccine at the time of injection? And are there any other medicines that people should avoid before or after you take the vaccine? We're hearing stuff about, ibuprofen. Should you take it? Should you not take it?
Yeah, so the only medical contraindication to any medication or anything that is advised against taking around the time of getting vaccinated is another vaccine. They don't want you to have had another vaccine within 14 days of getting your COVID vaccine. But other than that, I am not aware of any medications that are considered a contraindication. We don't have any that we have a list from the ACIP CDC group as a contraindication. So you should be good to get vaccinated.
Great, thank you. Staying kind of along in that, working with our 65 and older, we just have this outstanding educator named Lawrence from Shakota, Oklahoma, and he submitted a question for us. And I know Lawrence, he's already had his prime dose, but here's his question. Why is it so difficult to get a booster vaccine on the portal? And why can I go back to the original location where I received the initial vaccine? I think it was, why can't I come back to the...
Sure. No, and that's a good question. So understand that where you got your first dose, if you got special instructions to come back to that location without going through, portal or anything, that's fine. Just go back to it. If not, the portal does offer you that option, but I will tell you that we are managing those appointments, the number based off of what we know that we owe out, if you will. One reason you're probably having trouble finding that appointment is because it hasn't been put in yet, or it's just now being put in, because we haven't been putting in appointments more than a week out, because that's how much lead time we've been given on how much vaccine is coming in. I assume Lawrence is probably due next week if he was one of the early ones that got vaccinated. Next week is really when we're coming into that big anniversary. I suspect you're going to see appointments show up probably this evening or tomorrow. They will say, is it 2 weeks? I see Lawrence. 2 weeks, Lawrence? All right, I see that. Okay. If that's the case, Lawrence, they may not be up till next week for your booster dose, but we will have doses up there. And when you go in and look for that, they'll say booster dose only or second dose clinic only. And that's so that we can make sure and have those reserved for you folks that have already got your first one and you're going to get your second one.
My parents are next week, so I'm scoping it out every day now to see, because I know it's only a week in advance. Marie from our Facebook says, how do we prove we have a comorbidity? Do we have to have a doctor's note?
Oh, that's a great question. And I can't even begin to describe the number of conversations we've had about that during our planning phase. Because typically we would never ask for somebody to provide any proof of medical condition or anything for something like this. When you go through the scheduling portal, it asks you, if you have a comorbidity, and then you can check that's defaulted to no. You check it for yes. That in itself is going to put you in a category for that under 65 with comorbidities to get vaccinated. Now, later on in the scheduling portal, the screening portion, it'll ask you what conditions you may have. That's informational for our staff so that they can understand. We are not requiring, I'm a little hesitant to say this, but I'm going to. We're not requiring proof of a medical condition to qualify for that. Now, that's a slippery slope, I think, as you guys know, because that opens it up for people to come on board without any evidence of a comorbidity. That's one reason I say I don't think we'll be in that group for a long time, because we're just not going to open it wide open. We don't have any way, there's no real good way to demonstrate that. So we're asking Oklahomans to demonstrate that high level of integrity and honesty in their registration, and and answer that accurately and show up when they're eligible according to their groups.
Great, thank you. A question that I get a lot, and this comes from Teresa and more. Can we just set up vaccination site? Can it be set up at the district for teachers or in educators?
So potentially, yes, potentially it can be. Here's been my instruction to the local health jurisdiction. Partner with your schools, do what you can to make it as easy as possible, but you have to make good use of your resources. And let me explain what I mean by that. If we go out and do a lot of strike teams, go out and do like small groups, then that becomes very resource intensive. When we do large pods and we set up our staff and we process, 12 to 1,500 people in a day, we can accomplish a lot more with fewer resources just because of the way it's organized. So my instructions to them has been, if you can go and work with a district or maybe a combination of districts and set up a system that you can efficiently use your resources to take care of them, then I can see that working and I don't have any problem with that. But what we have to be careful of doing is losing our momentum on getting a lot of vaccine out to Oklahomans by breaking down and doing a lot of smaller strike teams. So one of the other options we've looked at is, there's companies that will come out, Passport Health, I think Total Wellness. There's other groups that may be interested in doing vaccines. Maybe some local partners that are pandemic providers may be willing to help us with that. So we're open to looking at any options that gives the schools, the teachers and the staff best possible access to the vaccine. It's just going to vary somewhat by area based off of size of facilities, maybe groupings of facilities, or available local resources.
Great, thank you. So that really just guides us right into our next question from Heather. If you don't know when teachers will get their shots, how did Oklahoma City Public Schools say that teachers would get their shots February 12th?
That's a great question. And when I heard about that, I asked that question that evening, actually. So that was what I found out from that. That was sounded like it maybe is based off of an estimate. Somebody on the health side, not the health department, but maybe another health agency, had kind of estimated that may be a time. And so they kind of set something up in case it was available for that. But I do not anticipate that we're going to be ready by February 12th. I wish we were. Trust me, I want as much as anybody to get you guys vaccinated, be that far into this program, getting Oklahomans taken care of. But being realistic, I don't think that is going to be a possibility. And I can assure you, if we can't roll it out across the state, then we can't approve it for one particular area, one particular school system.
So what I'm hearing you say, Deputy Commissioner, no districts are like jumping the line, able to get the vaccine before everybody else. It's just that was an estimate that was given.
That was strictly an estimate, yeah. And there should not be any. And I hear this every once in a while. I hear rumors, and usually what it is, it's maybe a local health jurisdiction is working with the school to take care of their 65 older population that may work there. But no, we're not. We have not authorized vaccinating pre-K through 12 teachers, and therefore we're not going out and doing it to the schools until that time when we turn that portion of our response on at the state level.
Here's a great question from Tara, who wants to know, why have teachers in other states received the vaccine already?
So it's really up to the states to determine the rate at which they vaccinate. And CDC has made recommendations, but it's not a requirement of the state. I will tell you the main reason for us in Oklahoma is we started out with the healthcare workers. We got to have a strong healthcare system because it's been burdened so heavily from COVID-19. And this is how we try to take care of those that have been impacted by COVID and are positive, try to keep them alive, healthy, and going home, right? So with that system is first responders and EMS. They're the ones that help support that system as well. And then we went into the 65 plus. As I mentioned earlier, 65 plus, I will tell you, somebody that is 65 and plus they're 7 times more likely to die than somebody 45 to 54, 3 times more likely to die than somebody 55 to 64. So we felt like we need to make our priority based off of true morbidity and mortality rates within the state from what we were seeing. That's the reason we prioritized that group. And then the next group with that was those with the comorbidities. We saw people younger than 65 dying, and it was almost always tied to a comorbidity. So we based those decisions on morbidity and mortality. Discussions with the governor's office and others was that we needed to move teachers up. We originally had them in phase 3, and we're on board with that, absolutely on board. So we felt like this was an area we could move them up to and still justify the fact that we were making decisions based off of morbidity and mortality for those groups.
Great, thank you. I know I hear that from my colleagues in other states, and it's frustrating, I know, for
Sure.
people.
No, I understand. And different states have approached this differently and for a variety of reasons. I'm sure I can't speak to any of them for other states, but those were the decisions that we made. I will tell you that CDC at some point altered some of their recommendations after we had started this program, after we had initiated some of our plans, and they started this program, and their plans would have put quite frankly, a young, healthy 30-year-old person that worked in food service, grocery store, whatever, ahead of some of our 65 plus. So we as a state just did not feel like we could go that route. There's tough decisions in COVID, tough decisions in trying to roll out a product like this. We'll call it a product for lack of a better word, that is so precious and means so much to individuals in their future. There's really tough decisions, and we understand the frustration that goes with it.
Thank you for that. Judith, who's a retired educator, what are your plans? She brings up a great topic. What are your plans? Do you have plans for helping vaccinate Oklahomans who may be homebound, that don't have transportation to a vaccine distribution, a vaccination site?
Yes. Now, and that's a great question. So what we do is we work through local jurisdictions with local partners, emergency managers. A lot of these local partners that we've worked on preparedness plans for years have a annex within their plans, if you will, that help identify the homebound, those in their communities that are at high risk. If you think about it, when you have ice storms and things like that, some of these people may be on oxygen, so they may have special needs. People need to check on them. So there's groups locally that help us list out these people and find these individuals. We are going to work with local partners to get out and get them vaccinated. Mm-hmm. But I will tell you, kind of almost by definition, they are not prioritized as much as some of our other groups. And what I mean by that is the nature of being a homebound helps to provide some kind of protection against COVID. And we ask that their caregivers and family or whatever are very careful, very cautious, continue to take those precautions to protect them, and we will get to them and get them protected. Again, we're collecting the names, we're collecting the list and putting them together, and partners that can help take care of them. But right now, I think the best thing that we can do to help them is interrupt the transmission of COVID in the community, which is what we do with mass vaccination. That helps slow down the spread, which helps provide some level of protection to them as well. If we stopped everything and kind of went and did homebound first, we would not be doing mass vaccination. We'd be sitting on a lot of vaccine in the freezer. And again, this is another example of the very difficult moral and ethical issues that come with this kind of program. And this is what we have to struggle with, throughout the planning and on a daily basis. But at this point, the best thing we can do is collect those names, pull our partners together, and get ready to go vaccinate them when that time is right.
Great, thank you. So let's talk a little bit more about the portal. Teresa from Moore has asked, how can you be sure you will get an email after registering?
Sure. Well, if you don't get an email, it's not going to do you a lot of good, because that's how you get notified of your link to go in and get an appointment. So most of the time, what we're finding when we get calls about the fact I didn't get my email, I didn't get notification, it's usually because the email is in a spam folder or a junk email folder, or maybe some other kind of, depending on how your email's set up, it's usually that the email is dumped into one of those different areas. So we encourage everybody to look through all those different email boxes and see if that email response is there. If not, and you feel like, you don't know for sure that you've registered, you can go back in and you can register again. You had to use a different name. So what we tell people is, if you may use your middle name, you may first and middle name, do something a little different than what you did the first time. And in some cases, we've had people with different email addresses, and that was a requirement early on. But I think we got that corrected to where if you'll use a different name as opposed to what you did the first time, it will now allow you to go in and register with your current email address, is my understanding.
Okay.
And you
So,
can re-register.
so by doing that, that's not going to mess up when they get to the vaccination site and it
No.
doesn't match up with the portal and all that
No,
goodness that happens.
We want you to use your name, but just maybe adjust that middle name in such a way that there's a differentiation.
Okay.
Okay.
Well,
and if you're not able to do that, then a different email address may be the way to go to try it that way.
That's how my parents have now multiple email addresses, because their daughter has helped them through this process. And we have a question from Victor in Stillwater, and it goes back to with teachers and I'm going to say educators, where we're at in the phase system. Who makes that decision? Is it a combination of health department, governor, who can make that decision?
So what we did is, early on, we used a independent group of medical advisors that we gave them kind of what our general sense of the priority groups were. And they went through and assessed those and kind of adjusted that order based off of what they felt like was medically prudent. And that's where it was, a lot of it was based off of morbidity and mortality. So basically risk to your health, and then the need to ensure that our healthcare system was strong. So they made that initial recommendation to us. We adopted it based off of what they recommended. And then, if you remember, initially all education was combined together in phase 3. And the governor's office asked us to take another look at that so that we could accelerate pre-K through 12, so we could help get our kids back in school and such. And we did pull, at that time, with that recommendation, we looked at it and we felt comfortable pulling pre-K through 12 out and moving them right behind the under 65 with comorbidities. So that was that process. The health department owns the plan. We own those lists. So for those that are upset about it, angry about it, whatever, I just say, talk to me about it. I'll accept responsibility for
it. And we'll be really nice and understanding about it when we do it.
Okay. if you say so.
I kind of look at it this way, Deputy Commissioner. I always hear President Priest say, the vaccines can't get here soon enough.
That's right.
And there is that the people are wanting to take the vaccines. That's a good thing. And they're ready to take them. And Oklahoma is getting shots in arms. So we're making it work. It's just not working on our timeline for a lot of people. So
No, I hear you, and I tell people all the time, we're making progress and everything, but it's not enough. And from our standpoint, as the health agency responsible for rolling this out, there is at no point during this rollout are we satisfied with the rate at which it's going. We're not going to be satisfied until it's done. So we share that frustration with everybody else. Absolutely understand it. At the end of the day, we all had to face the harsh reality, though, is that we have limited vaccine, and it's going to take some time to get it out. And if we can all pray for more vaccine, more supply, that opens up a whole world of options for us to get vaccine out to people quicker.
Right. Thank you. Serena has asked, great question. We're hearing about the highly contagious UK variant, a variant from South Africa is now in 28 of our states. What is being done about this? Is a vaccine effective on this?
All indications at this point is that the vaccine is effective on this. So this is really Dr. Taylor's area, our state epidemiologist, but I'll tell you, a coronavirus itself is fairly stable. These are some mutations. These are some minor changes within the proteins of that. But a coronavirus itself is fairly stable compared to, say, flu. Okay, so your flu virus every year, you have to get a new vaccine every year because as the flu travels around the globe and the different hemispheres, it mutates, and what comes around next year may be completely different than what we had this year. Coronavirus is much more stable than that. We have had some of these mutations, but these mutations are not so extreme that there is concern that the current virus or the current vaccine will not be effective against it. So we continue to monitor for it. That requires special DNA sequencing or RNA sequencing to identify it. And at this point, we have not officially identified it in the state, but we're operating under the assumption, as widespread as it is, that it's probably here in the state right now as well.
Okay, great. I was listening this morning and they were talking about let me ask this question real quick. Getting the vaccine, does it mean I don't have to wear my mask anymore? Does it mean I can snuggle up to my parents now that I haven't got to hug in 9 months? Does it mean I will still wash my hands? I will do that.
So, yeah, and that's a great question. First of all, let's talk about what fully vaccinated is. Fully vaccinated is you've had both doses and you're 10 days past that second dose. Okay, that's somebody that we would consider to be fully vaccinated. In other words, they should be at a point that they will get the maximum protection from the vaccine. There is a risk that you could still pass COVID on to somebody, even though you yourself do not manifest COVID as a disease, but you were exposed to it. So if you think about what happens, if you're exposed to somebody, if you're vaccinated, you're exposed to somebody that has COVID, the vaccine doesn't stop the virus, out here. You still take it into your body, and then the body's immune response comes into play and fights it off and prevents it from developing into disease. But you still have brought that virus in, so you can shed that out of your body. Okay. So there is a slight risk that you could potentially shed the virus and somebody might be contagious. It's much reduced because you're vaccinated. It'd be much smaller quantities. So it's definitely a reduced risk. So here's what we're saying. We still want people to continue to wear the mask no matter vaccination status. Continue to social distance no matter vaccination status. Continue to wash your hands no matter vaccination status. We've got to break the transmission of COVID. We got to get it behind us, and we've got to take every precautionary measure we can to make sure that we do that. Now, having said that, our policy is going to be, if you are fully vaccinated, in other words, you're 10 days past your second dose, and you have been exposed to somebody with COVID, we're not going to require you to quarantine. We're going to ask you to continue with the precautions because you're already at a much reduced rate or risk of spreading it. So we're still going to ask you to continue to wear the mask, social distance as much as possible, continue the hand washing, good hand hygiene, and just continue those precautions. So we're not going to require quarantining for somebody that's vaccinated, but we're going to stop short of saying, rip off the mask, whatever you were saying about cuddling up with somebody.
Well, I was just hugging them. I was just going to hug my
hugging them.
parents.
Okay.
Just hugging my parents, just to hug them.
and we want that so bad. Seriously, I think of the long-term care facilities, because for me, just to see the past year and the restriction on visitation and such in those areas, that's heart-wrenching. So we just ask everybody to do everything they can, take the precautions, take the extra precautions. Let's break the transmission of COVID. Let's get the pandemic behind us so we can get back to some sense of normalcy.
Yeah. After I said that, I thought, oh, that sounded so. I just want to hug I want to hug my parents. Is what I want to do.
I get it. Trust me, I get
it. Katie asked a really great question about, speaking of the variants. Are we tracing variants of COVID strains in our state? Are we seeing any of those right now?
At this point, we have not identified any of the strains that you've heard about. So not all tests that are done in the state go for additional sequencing. What happens is the labs look for something that may look different from their routine, and then that can be sent off for additional sequencing in another lab in the state, for example. At this point, we have not positively identified any of those variants, but we continue to watch for samples that need additional sequencing to try to identify those.
Okay, great. So we have a question from Superintendent Deborah Guest from Tulsa, and really it's also a comment as well. School districts are the largest employers in our communities. We can help get vaccinations in arms quickly and in a wisely prioritized way.
Okay, I would agree with that, and that's the reason we're encouraging our local health jurisdictions to work with the schools. We recognize that schools have a tremendous amount of resources, and I think through local partnerships, we can be efficient and effective the way we get vaccines out. And that's, as I mentioned earlier, that's kind of my standard to local health jurisdictions, is you've got to continue to make good use of your resources so that we're maximizing the amount of vaccine we can get to Oklahomans across the state. So we look forward to those relationships and working together. And quite frankly, from my standpoint, where I sit at the state health department, I love to see the creativity that goes around the state in partnerships and pulling this stuff together. I'm continually amazed at some of that. So I'm looking forward to seeing how some of these partnerships play out.
Yeah, 500 and something school districts in the state. We've learned how to really partner to make things work.
Absolutely.
So we're pretty much we're good. We're good at that.
Absolutely.
So let's talk a little bit about boost doses again.
Okay.
A retired educator, Lynn from Tulsa, had asked, okay, so I've had my first dose, my prime dose, and should I be worried about getting my boost dose that might not be available?
So I'm glad that question came up, because I really want to make sure to address that, because I know there's concerns out there about the second dose. So a couple things. Let me first say that CDC came out last week and said that range, that 21-day for Pfizer or 28-day for Moderna, could actually be as much as 6 weeks. Okay. So I put that out there, not because that's our intent. We're not going for that. We're not shooting for that or anything. I just want people to be reassured, if you don't get it on day 21 or day 28, that's okay. You're going to get your full protection from it. Now, what we've done, because for us, it is so important that we get vaccine from the freezer into arms as quickly as possible, that we are, and the fact that Operation Warp Speed and CDC kind of quit holding that second dose, that booster dose, because originally they held it and then they would send it right at the time it was due. They quit doing that and just started sending to us, even though they label them as prime and boost. Here's what we're doing. we're considering all that inventory. And instead of sitting on vaccine that is labeled as boost, which is actually the exact same vaccine as that might be labeled as prime, instead of sitting on that, we are managing those boost doses through an appointment system. So all this is inventory, and each week we set up the amount of boost appointments that we know are coming due based off of the recent history, 3 weeks back for Pfizer, 4 weeks back for Moderna. In doing so, that allows us to keep processing vaccine as quickly as possible, maintain that burn rate, getting it into Oklahoma's arms so it can do some good, but also prioritize your boost dose to make sure you get it. And what that may mean is some weeks it may be very heavy on boost doses. Next week, most of what we're going to give next week is going to be boost doses based off what we did 4 weeks ago. So there won't be a lot of prime. So we're going to make sure and prioritize appointments to get those boost doses first. Doing it that way, I would say, no, you don't need to worry about the fact of, whether your boost dose is going to be available. It's not about an inventory management system. It's an appointment system, and we will make sure appointments are available to get you your boost dose.
That is so reassuring to Oklahomans. Working with our 65 and over population, that knowing that assurance that it's going to be there when they get it.
Absolutely. We understand that.
Yeah. So talking a little bit more about that, talk a little bit about what our vaccine inventory looks like. How many shots do we, okay, can I just say this? It blew me away to know that you guys only knew on Tuesday what you were going to get for the next week. That was, okay.
Yeah.
That was difficult to swallow. So knowing that, what does your inventory look like, and how many shots do you get a week, and how does that compare with the demand that we now are working with a population around 600,000 people?
Right. So we were informed by what was previously called Operation Warp Speed. Now they call it the operation with the change in administration. But the operation informed us yesterday that we should anticipate a 16% increase in our overall vaccine supply. Now that specifically is based off of a 30% increase in our Moderna vaccine. So that 36% or that 30% increase in Moderna, 16% overall, is going to leave us at 103,650 doses, I think it is, for next week that we will receive. That's what we found out late yesterday we would be getting next week. Then we've been told that we can anticipate that to be consistent for the next 3 weeks going forward. So each of the next 3 weeks, we anticipate getting 103,650 doses of vaccine, all sources combined. Previous to that, we were getting around 86,000, but I want to be clear, that is all sources. So that's what they said they were holding back as boost, and then they started shipping and adding in. So that's all. That's vaccine that goes to prime and boost doses all together with that. So if you look at that and you think about what we have to give, 65 plus, for example, is about 635,000 people. Now you've got uptake questions. The math is very difficult to pin down. I'll leave that to you guys, all the math teachers out there. For me, it's a struggle because uptake rates, all those kind of things. But let's say 635,000 Oklahomans 65 plus, we're going to take it. That's actually what? 1,270,000.
I know Alicia's going to pipe in here really quick with the figures.
I think it's 1,270,000 doses. Okay, because it's a 2-dose series.
Mm-hmm.
So that gives you an idea of how much it takes to work through some of these groups. Again, as I mentioned earlier, we're not looking to get all the way through our 65 plus. We want to make sure that we keep them in a fair situation, that we can protect them because they're so disproportionately impacted right now. And we're talking, such a high rate of death and all. So anyway, the inventory is completely insufficient for us to move at the rate we could move. We have all kinds of tools in the toolbox is the way I usually refer to it. All of our partners. I have hospitals calling saying we could set up clinics and do 2,000-3,000 people a day, 5,000 a day. We've got all kinds of partners that are ready to step up and do that, but we don't have enough vaccine to give them in order to do that. And that's where that's our bottleneck right now is vaccine supply. It always sounds like we've got vaccine because every week we do get more vaccine that comes in over 2 or 3 days. So it's always a repeat amount. 97,500 of those doses that we have right now, I can't even touch. That's part of the long-term care program. That sometimes is reported in. Boost doses, prime, all is combined. So I assure you we're working through inventory as quickly as possible, but we don't have near enough inventory to meet the need.
So we're gonna let Lawrence have the last question of the night, and which is great. It's a great question because I can tell he is preparing himself for his boost dose. He wants to know all the facts there is.
Okay.
Why does it appear that a few friends of you have friends, obviously, Lawrence, a few friends of mine who have had their second dose of the Moderna vaccine have had lots of side effects compared to the first dose? Is this common?
Okay. Actually, it is common, Lawrence. So get ready for your second shot. No, it happens. It doesn't happen for everybody. So the science behind that is that first dose that's the reason they call it prime. It primes your immune system and it teaches your immune system to recognize that that protein that's on the surface of the COVID virus. So your first dose, some people have a little bit of reaction, but some people don't have much of a reaction, or many people don't have much of a reaction. But when you get that second dose, your immune system is already primed to recognize it. So it's going to vigorously respond. And that's what you want. You want it to boost. You want it to respond vigorously and build up a lot of antibodies so that your entire system can recognize the virus if it's introduced into your body again. What they're reacting to is that immune response, that really heightened immune response. It's uncomfortable for those that have, and we're hearing around 10% of the people may experience this. And it's uncomfortable for a day or so, but on the flip side of that, it's a great indication that your body is responding really well to this vaccine. And I would anticipate you'd have really good protection for it. So a little discomfort for 24 hours is certainly a reasonable price to pay to avoid COVID and all the bad that can come from it.
Right. I'm going to keep telling myself that when I feel all that, it's just my body's working really hard. And I learn now the reason why it's called prime and boost. I feel so super smart. So thank you for that. So we want to wrap this up. And I want to ask you one last question.
Okay.
As Deputy Commissioner, what's something that keeps you awake at night about vaccines? And what gives you hope?
So I'll tell you what keeps me, it keeps me up a lot at night, is failing to get the vaccine out as quick as we need to. We have, we're accountable to Oklahomans. We have a lot of responsibility to get this out to Oklahomans. And vaccine in the freezer doesn't do anybody any good. I always tell my staff, a vaccination potentially saves a life. And it potentially keeps somebody in the hospital. There's so much impact. It's so important. And then the other thing, especially with the current population, is knowing that I can feel from the feedback we get, our 65 plus population, they're scared, they're anxious, they're just so fearful of COVID. They want their vaccine, they want it now. We can't give it to them, and we can't give it to them fast enough. That keeps me up, quite frankly. But again, on the flip side of that is knowing that we have vaccine coming and knowing that every shot potentially saves a life. When we get these large pods done and we get 12 to 1,500 people, I see that as potentially breaking the transmission of COVID in the communities so that we're slowing down the spread of the pandemic. I see this as our way of getting the pandemic behind us and getting back to some sense of normalcy. So we just need to all come together and get this done and get it done right and take care of Oklahomans the best we can. And it's just not an easy task, but it's well worth it.
Deputy Commissioner Reed, thank you so much for being with us. We just want to express our gratitude to the Oklahoma Department of Health, our county health departments, our frontline workers that are putting those shots in the arms, the volunteers that are making this happen, that we can get Oklahomans, our communities back to some semblance of order again. We'll continue to wear our masks. We're going to continue to watch our distance and definitely continue to wash our hands. So thank our members that have been on with us on the Zoom call or watching on Facebook Live. Thank you for joining in, and be safe, be well. Thank you.